Okay, great. So I'm pleased and honored to be here with you today. My name is Miha Arnol, and I'm collaborating with Jadranka in this REMAP Renal Expert in Molecular Pathology, Model 1, of course, which will be focused in our center in the expertise in kidney biopsy. So in the introduction, let me say that there is no nephrology without nephropathology, and there is no nephropathology without percutaneous kidney biopsy. You can probably all agree with me. And I may say that percutaneous kidney biopsy is an integral part of nephrology clinical practice for many decades now. However, in many countries over the past decades, this procedure was transitioned from nephrologist, as you may know, to interventional radiologist in many parts, not only in the Europe, but also specifically in the US. And I believe strongly that REMAP course will teach young nephrologists in the state-of-the-art nephropathology and train them in kidney biopsy, which I believe is a fundamental invasive procedure for our profession. And we expect that our young nephrologists will nurture and further develop this knowledge and skills of these procedures for the benefit, of course, for our patients and nephrology in general. And this is our University Medical Center in Ljubljana, which is quite a big hospital, more than 8,500 employees. But sorry, I will focus on our nephrology department, which includes 200 employees. 23 licensed nephrologists, and actually we are quite sexy for our nephrology fellows. We actually have on board 18 nephrology fellows and also one young basic science researcher for the translation and medicine research. We have several habilitated teachers, including full professors, associate professors, and assistant professor, more than 10 PhD students. And we are actually quite a large unit in our center. We have 7 in and outpatient units. Our in-hospital units encompass 32 beds, including regular and transplant department. We have 2 hemodialysis centers with more than 230 patients, then center for peritoneal dialysis and also center for kidney transplantation. And we actually take care for the complete national cohort of our transplanted patients. And we are happy that we actually own our own ultrasonography unit where we also perform our biopsy procedures. And on a yearly basis, we perform around 300 native and kidney transplant biopsy procedures per year. So we actually perform, as already mentioned, all these procedures in real time under ultrasound guidance by a single operated, which is nephrologist. And I think this should be the standard of practice in large and good nephrology centers across Europe. So this is a brief review of this hands-on training with the tutors in this renal biopsy. As you can see in 4 university hospitals in Bari, in Sacco, in Milan, then in Ljubljana and in Prague. I think each center will host 10 trainees. Here are the tutors, and then I think more or less all these trainings will be held during the November, and then after this training, the students will meet in Amsterdam for 3 days and for the digital pathology seminar, and we've heard about this session in the previous talk. So here is the brief overview of this hands-on training in kidney biopsy with the associated topic, and this will cover some theory, and then our students will be present in the operating room with real patients, and of course we will review the procedure with some recorded videos, and of course we will be using some teaching aids which were already introduced in the previous talk, such as the augmented reality simulator and renal biopsy simulator. Our students will then learn how the biopsy cores are processed, and then on the renal ultrasound follow-up and possible complications after the biopsy procedure. So here is a day-to-day schedule. I don't want to go deeply into that. This will be a 4-day course in these 4 centers, including our own. And I'm very happy. We just received one of these Blue Phantom training models, and we are training ourselves on it right now to get familiar with this. And this is even more important. This is the VR simulator we already introduced in the previous talk, which allows to perform interactive kidney biopsy in the virtual reality environment. We are still awaiting for this simulator. I think it's coming at the end of this month, and we are really happy to get familiar with this, I think, very interesting learning aid. So our clinical center have more than 30 years of clinical experience in performing native untransplanted kidney biopsies. Also expertise in comprehensive kidney and renal vascular Doppler ultrasonography. And we know that today kidney biopsies are performed in more and more complex patients than ever before. Let's say in the very elderly with many comorbidities, limited cooperation. Patients were taking anti-aggregating or anticoagulant therapy with acute and chronic kidney disease, sometimes solitary kidneys, and multiple cysts. So safety is priority, and this actually demands expertise in renal Doppler ultrasonography with good equipment and instruments. And I think, and this is also our practice, we use this dissection microscopy in real time because to assess sample cruelty. Usually after each needle pass, and then to adjust based on this information the needle size to reach sufficient sample cruelty, of course, while maintaining maximal safety. And this is our routine clinical path with checklists that we use in a day-to-day clinical practice for all our biopsy procedure in and outpatient. And we use this information to ensure cruelty and safety for every procedure on kidney biopsy. And we will share this information also in English language for our students. And this is our dissecting microscopy. We actually own one of these in our ultrasound and biopsy room. And as already told, sample is evaluated after each needle pass. And if active bleeding is observed after the first needle pass, then operator discuss this with our technician. And if sample is insufficient, and if molecular diagnostic is planned, we do a lot of molecular diagnostic this way, specifically in kidney transplant biopsies, then we adjust further procedures according to real-time information. I think this is very important. And of course, at the end, I would like to say to welcome you at the REMAP in Ljubljana, Slovenia. And let's bring kidney biopsy back to nephrology, I may say. And I strongly believe that no one can do it better than ourselves. Thank you very much for your attention.